Hey guys, Peter here from Team Sapiens PT. Today I wanted to talk about a problem a patient of mine has been having after their knee replacement procedure. So the person's getting better, their pain is less, the range of motion is better. The issue that they're having is they have a dog at home and they want to take it out for a walk. However, the dog is like 60, 70 pounds, so it's a bigger dog, and they're concerned that I have my left knee marked here as the involved leg so you guys can identify it. The concern is that if they take them out for a walk, one, it's the winter. Ice is a concern, slipping and falling is a concern. But also if the dog takes off for any random reason, are they going to be able to stop the momentum and control the situation on their surgical leg? So the goal here from a physical therapy perspective is we know where they want to be. How do we take steps to, one, build up their confidence and work towards something that's difficult or maybe even impossible for them to do right now without getting them hurt or setting them back. So this is what I did with her. So if this is the involved side, we started working on some dynamic stepping where she works to slow down her momentum in a very controlled setting. So that's one way to simplify the task, where if a dog pulls on a leash, you're going to have to stop your momentum, but you don't know when it's coming or how hard you're going to have to work to control the situation. So we simplify things by she's in total control of the speed, how far she moves, how fast in between reps, we can slow this down, and also she knows what direction she's going in. We can make it a little bit more complex by adding different directions, sideways, backwards, crossing over even, different diagonals. The next step would be potentially to increase the pace of the movement, making the leg that's doing the stop work harder, because if you enter with more speed, it has to work harder to slow that momentum down. Could go off at random directions. And then we can also add force. So with an elastic band here, we can kind of mimic a leash. So this is still pretty controlled because you know exactly where the band is pulling you in. But it does add an external load. So I forget how much this band is actually rated for, but we have one that says like up to 70 pounds. So eventually maybe we could work up to that one to kind of mimic the amount of pull you might get from a 70-pound dog. That's not going to translate one-to-one, but you guys kind of get the idea there. Another aspect of this is if you're walking a dog and it just decides to run off, you don't necessarily know when that's going to happen. So how I would deal with that is same setup, but I'd be on the other end of the elastic band instead of the squat rack here. And then I just start pulling at random intervals, random directions. Maybe she takes me for a walk, and then I just decide to pull, and we kind of do it in a semi-controlled environment to build her confidence up, test whether it's something appropriate for her to even try right now. And hopefully that gets her back to walking her dog on a daily basis without an issue. So, hope you guys learned something. Hope you found it interesting. If you did, hit subscribe so that you get notifications of new videos. And if you have any questions, I'll leave my email in the description so you can contact me there. Take care until next time. See you later.